I'm Donna Russo. I'm a social worker here at the Burke Rehab Hospital. I wanted to talk a little bit more about some of the other symptoms of COPD that often go unnoticed or that people don't usually talk about. The physical symptoms of COPD, very important. You all know about the proper use of oxygen and taking your medications properly, keeping active, using your breathing strategies, using your relaxation strategies often, not to overdo it, keep active, drink plenty of water, maybe even get involved with a wellness center or fitness program or a pulmonary rehabilitation program. Understanding all of these symptoms of COPD are so important for you to be able to talk to your doctor and your caregivers. But being aware of the physical symptoms aren't the only symptoms to be paying attention to. Please don't ignore the emotional symptoms. Mood affects your breathing. How can you feel good when you're feeling poorly? How can you take good care of yourself when you're not feeling so great? So there's some common feelings that are associated with the COPD. Shock, disbelief, when the doctor first tells you you have a diagnosis of COPD, or you had a touch of COPD, a little bit, slight case, some of those words come about to make you think that it might just go away. Anger, sadness, depression, fear, a lot of anxieties. Talk about it. It's very important that you talk it out. When these feelings come, it's easy enough to talk about the physical symptoms. It is not so easy to talk about the emotional symptoms. Take long talks with your doctor, your family, your friends, your therapists, nurses, people that you come in contact at the wellness center, at the fitness center. Don't hold back. Talk about what's going on. If you still aren't sure what your diagnosis is, you may not be taking your medications properly, or you may feel like you only need to take them when you're not feeling well, or you may still be smoking. Time and getting a better understanding of what COPD is all about is going to help. It's okay to be mad, but you have to understand why. What's making you feel angry? Is it accepting help from others? Is it the change in your daily routine? Is it because you can't quit smoking and you've tried many, many times? Whatever the reason is, talk it out. Another normal response to not being able to breathe: anxiety, fear, panic. Shortness of breath brings about all those reactions. Practice your breathing strategies, practice your relaxation strategies throughout the day, but think about what is so frightening. What is the worst thing that can happen? Talk to your doctor about what you think could happen. And then when this anger gets turned inside, that's when we see signs and symptoms of depression, sadness. Eating habits may change. Sleeping patterns may change. You may become more withdrawn. You may lack interest. You just don't want to go out. You don't want to see people. You don't want to be around people. You gotta talk about it. How can people help you if they don't know what you're feeling? You need to reach out. Your physician is your first primary contact. Let your doctor know what's going on. There's nurses, there's therapists, there's many community resources for you out there. If you're still smoking, that's the place to start. You might want to reach out and call 1-800-QUIT-NOW. You'll get a personal coach, help you get through this. They'll give you websites, but that's a good place to start. If you want to get together with other folks that are suffering from COPD, find a support group in your area. Again, your physician would be able to tell you a local group. Otherwise, you would call the American Lung Association at 1-800-LUNG-USA. If you live in Westchester, there's a Better Breathers Club right in Tarrytown. If you don't have a pulmonary rehab program near you, you may have a wellness center. Most of the local hospitals now develop these fitness programs for their patients. Call your local hospital. At Burke, we have the Burke Smart Fitness Program. For more information, you can call here. If you're under 60, Another good resource for people is the independent living centers. But if you're over 60, a great community resource is your Office on Aging. They offer a variety of senior services, including home-delivered meals, transportation, emergency personal response systems. For those folks that feel like getting out isn't easy, that it's getting harder and harder, or they don't feel like they can drive, or that they feel uncomfortable getting out with their oxygen, there's also a number of programs that offer door-to-door transportation. In Westchester, we have paratransit, and in the boroughs, we have Access-a-Ride. Most major medical insurance policies, including Medicare, do cover outpatient mental health visits. There are so many out there that you really need to sit down with your doctor and ask which one might be right for you. In Westchester County alone, we have Catholic Charities Counseling, Family Services of Westchester, Westchester Jewish Community Services, the Guidance Center in New Rochelle, and a whole host of other places that you can turn to for help. And if you're a little shy about getting on the phone and talking to people, but you're pretty good at the computer, there's some helpful websites for you also. COPD.org gives you a lot of information about what COPD is all about. COPD Digest gives you publications that you can send away for or download. Pulmonary Paper is another good resource for people with COPD to stay connected with other people with COPD. So the best way to achieve success is to understand your symptoms and your medications, exercise regularly, pace yourself, use your relaxation and breathing strategies, but more importantly, confront any isolation. Reach out, develop a support network, tell people what you're feeling and thinking. This is a good time for you to sit down with your family and friends, let them know what you hope to achieve, what you hope this COPD will mean for you down the road. It might be a good time to start talking about having a healthcare proxy, so that in the event you're in the hospital and you're unable to talk about what you need to do, you have somebody that understands what your wishes are. All the local hospitals and the admitting departments have these healthcare proxy forms that you can just use it as a tool. Sit down with your family. Thank you. I hope this information was helpful. And more importantly, I hope you feel that you're not alone.